Story time. Life is spiritual. Yes, life is spiritual. I want to share an encounter I had with a Satanist in the hospital where I worked as a nurse. This is a true life story that happened a few years ago at a hospital in Texas, United States. I was scheduled to work a 12-hour shift on a Saturday night. My shift starts from 7 p.m. at night till 7 a.m. in the morning. It was a normal day at my workplace, a hospital in Texas. I work as a nurse. As my shift started, the charge nurse told me I am getting a patient from the emergency room who is being admitted with a leg wound and needed surgery the following Monday. The patient arrived to my unit and settled into room 1. I started what we call admission process, doing physical assessment and obtaining health history. One thing I noticed during his assessment was strange tattoos of human skull, snake and skeleton all over his body. At one point during the assessment, he asked me how many patients I am taking care of and I told him. His next question startled me. He said, "Wouldn't I be happy if one of my patient died tonight?" I thought I did not hear him well and told him to repeat his question, and he said again, "Wouldn't I be happy if one of my patient died tonight?" I immediately knew I am dealing with a Satanist that is not actually in the hospital for surgery but rather he is looking for blood sacrifice. I angrily replied. I rebuked him and told him that I send that spoken word he uttered back to the pit of hell where it came from. I told him I am here to take care of the living and not the dead. Immediately his countenance changed. He became irritable with everything I do. I told my charge nurse what my patient said, but she really did not understand the spiritual implication of such utterance. I immediately went into warfare mode. I started praying for my patients and pleading the blood of Jesus over them. As we continued with our shift, around 3 a.m. in the morning, I heard a page of code blue. We use code blue in my hospital to announce when a patient goes into cardiac arrest. Cardiac arrest means patient heart have stopped. As we all nurses and other medical practitioners rushed into the room of this patient with cardiac arrest, I remembered my patient in room 1, the utterance he made previously. Even though the coded patient is another nurse's patient, I started praying and rebuking the spirit of death. To God be the glory. The patient came back to life and was transferred to intensive care unit. The nurse that had this patient was surprised about the cardiac arrest because the patient was not that sick and had no symptom prior to the cardiac arrest. I knew it was spiritual, but my coworkers were not getting it. After my shift ended, I went home. It was a Sunday morning. I went to church and prayed. I made up my mind as I go back to work it will be serious warfare as long as the Satanist is still in my unit. To my greatest surprise, as I got to work for another 12-hour shift, the nurse giving me report told me that patient in room 1, that is the satanic patient, just went downstairs just to take a walk and he will be back. As I continued with my shift, while waiting for patient in room 1 to come back to his room because I have some medication to give him, especially his antibiotic, just around 8 p.m. I got a phone call from him, the satanic patient, and he said, "Nurse, I am letting you know that I am not coming back. I have discharged myself." I was trying to explain to him that he has surgery scheduled for Monday, but before I could even finish speaking, he hung up the phone. That was how this satanic agent ran away and did not fulfill his mission. Thank you for watching and please subscribe. Blessings.